Greetings AI Forum audience. Welcome to AI Conversation episode number 2, the flagship series of the AI Forum dedicated to discussing crucial AI-related matters that bridge the gap between industry, academia, and policymakers. My name is Sambath Cheab and I'll be moderating today's session. For today's conversation, we'll delve into the topic of AI and health. We're honored to have Mr. Sambath Cheab here with us. Mr. Sambath is a family physician and health professions educator from Cambodia. He's played a key role in medical curriculum reform, and his work focuses on AI, healthcare, and education. Today, we're going to explore how AI is transforming healthcare globally and in Cambodia, along with the challenges and opportunities it presents. Welcome, Mr. Sambath.
Thank you, Mr. Vatsya. It's great to be with you today.
To start, Mr. Sambath, could you explain how AI is being used in healthcare around the world? What advancements are we seeing, especially in healthcare professions education?
Sure, Vatsya. Globally, AI is making a big impact in healthcare. Think of AI like the technologies that helps analyze large sets of medical data faster and more accurately. For example, AI is heavily used in diagnostic, like analyzing X-rays, MRIs, and CT scans. Study shows AI can detect conditions such as breast cancers earlier and more accurately than humans in some cases. AI is even some cases outperforming radiologists in detecting early stage cancers, which are usually hard to catch. On the health professions education, AI is expanding beyond simple learning tools. Generative AI platforms are helping medical students and lecturers solve problems, answer clinical questions, and generate reports. They provide instant feedbacks and adapt to each student's learning style. AI driven simulations using virtual reality and augmented realities are also transforming how students practice medical procedures without risk patient safety.
Thank you for shedding light on the global landscape, Mr. Sambath. It's truly amazing how AI is making strides in diagnostics and education, helping both patients and medical professions alike. Now, bringing it closer to home, let's talk about Cambodia. So, how is AI being applied in Cambodia's healthcare sector, and what ethical concerns should we consider?
In Cambodia, AI in healthcare is still in its early stages, but the potential is huge. Telemedicine, for example, is really promising in rural areas where access to healthcare is limited. AI powered systems allow patients to consult with doctors remotely, saving travel time and providing quicker access to care. Few pilot programs are already being tested using AI for telemedicine and data analysis to make more informed decisions. We've also established a digital health department within the Ministry of Health, Cambodia, to focus on digital technologies and AI policy, regulations, ethics, and its applications. This ensure AI is used responsibly and aligned with professionals' healthcare standards. Some practitioners here in Cambodia are using AI for tasks like translating medical jargon word into more accessible language, helping patients understand their conditions better and also their family. In health professional education specifically, we incorporate AI into developing case-based learning and MCQs for student assessments. We've even integrated courses on AI ethical use in the new medical curriculum. Generative AI's tools help us as a planners review curriculum documents and provide feedback. But it is important to note that all of this is based on my experience, involvements. None of it is published or formal research to be declared.
It's encouraging to hear that Cambodia is laying the groundwork for AI in healthcare, with promising developments in telemedicine and education. But like you mentioned, with great advancements comes challenges, especially ethical ones. That brings me to my next question. What are the key benefits and challenges of AI in healthcare?
Well, AI definitely have clear benefits. It helps doctors diagnose diseases like cancer earlier by analyzing medical imagings in ways humans might not see. It always tailors a treatment to each patient, just like how Spotify recommends music based on your preferences. But there are challenges. One big issue is bias. If AI is trained on data that doesn't represent everyone, like focusing on only urban patients or Western literatures, it could lead to mistake for like a community specific. I mean, in Asian patients. So that's something need to be considered. Yeah, and another challenge is accountability. If AI makes an error, who responsible, the doctors or the developers? So that's the question of the policies. So that's why we need to ensure that AI tools are scientifically validated by experts and that users remain responsible for how AI is applied. Yeah. In education, I focus on education because like students, they use AI, but they need to remember that AI is a tool for learning. It's not a substitute of thinking or replace thinking or replace working. AI can help, but students must still use their own judgment and critical thinking responsibly on each every word that produced by AI. Yeah, so it also reflects to the policy of the school that need to have a clear guideline of what is the good use of AI, what is the bad use of AI, plagiarism, and uh, that's the thinking of technology hindered learning. It's not about technology enhanced learning. So we want policies to make the environment of support student learn, but not hinder student learn. So that's the idea.
Great insights, Mr. Sambath. Those are some very important points, especially when it comes to bias and accountability in AI. I completely agree. It's crucial to recognize both the potential and the risks. And speaking of collaboration, let's talk about the role of different professionals working together to make AI integration successful. Finally, how can interdisciplinary collaboration help AI achieve better outcomes in healthcare, especially in Cambodia?
Well, yes, collaboration is critical. AI isn't just about technology. It requires healthcare professions, doctors, engineers, data scientists, educators, and policymakers working together. This ensures AI systems are effective, safe, and ethical. In Cambodia, this aligns perfectly with the government's pentagonal strategies and the Ministry of Health strategic plan. These initiatives focus on digital health and AI, but we need clear policies to guide its use. We have still earlier in this journey, so we need a well planned, realistic action strategies and a group of people who have capacity to do it. This includes financial support, technical expertise, and strong leadership. I am a medical doctor and educator. I'm not a tax expert or policymakers, but am committed to involving, improving healthcare through the leverage use of technologies and AI. That's why I'm calling on those who can offer investment, technical expertise to collaborate with us and help build a healthcare system that fully leverage AI.
It's clear that AI is not just a technological shift. It requires a collective effort across various sectors to truly make a difference in healthcare. So, to wrap up, what key messages would you like the audience to take away from today's session?
Yeah, thank you. Here's my three takeaway of one: AI enhance healthcare. It doesn't replace human empathy and decision making. Two, collaboration between tech experts, healthcare professions, and policymakers is key to successful AI integration. Three, we must prioritize ethics and accountability. AI responsible use must be guided by clear policies. AI has incredible potential to transform healthcare, but this journey requires collective effort. As a doctor and educator, I am committed to ensuring AI improves patient care and policy and healthcare in education. I urge all stakeholders, technical experts, investors, policymakers to collaborate with us, ensuring AI is used ethically and responsibly to make a real difference in healthcare outcomes.
Thank you so much, Mr. Sambath, for those insights. It's clear that AI has the potential to transform healthcare, but it's up to us to ensure it is used ethically and responsibly. I also want to extend my gratitude to all our audience members for being here today and for your continued support. Your engagement is what makes these conversations meaningful and impactful. We look forward to seeing you at our next AI conversation. Thank you and have a great day.